Longevity Maine is a preventative healthcare, so we combine direct primary care physician services, training, and nutrition, and we take a proactive and preventative approach.
You know, strength training, exercise, nutrition, they're all linked together. And, you know, to optimize health and longevity and health span, patients need to be active in all three. And then one of the things I think we do well as a team is we communicate with each other well about each patient to make sure that they're getting seamless care across all three and that we're all on the same page.
For us to be able to talk to each other moves things along so much faster, because when you pull one lever, when you pull nutrition, you see changes in fitness, you see changes in overall vitality. And so we're really able to optimize for people and get them answers and just like move them forward way, I think, faster and clearer than they're finding when they're trying to just navigate it themselves.
We've kind of shifted now where most of the diseases are diseases of aging, which take years and decades to develop. So the best way to treat those is by prevention. And so this is where a proactive longevity approach really comes into play. We use cutting edge science to work on preventing the diseases of aging before they show themselves.
That was way better than I thought. Way better.
One thing that we look at in longevity is your ability to generate power.
Okay.
So power is like, thinking about it in practical applications, if you're walking in the woods and you trip and you can quickly put your foot down, that's a reflection of power.
Oh, okay.
That declines faster than strength and muscle mass, and fall risk as we get older becomes very real. So we're trying to minimize fall risk by making sure we have enough power.
Okay.
We test this in a couple of different ways. One of the ways is vertical jump. Yeah, it did, 14.3.
Yeah!
That's so good. Another thing in longevity we look at, so that's power, which is kind of your quick, explosive. The next thing is strength. One way that we do this is grip strength. So we can either hang from a pull-up bar and basically go for as long as we can. Another way that we can track grip strength in a quicker, like less painful way is by squeezing this, which populates a number, and then we can quantify. One hand, yeah, good. And then let go. Perfect, 69.4, that's great.
Is it?
That's really good.
Okay.
Yeah. VO2 max is a great predictor of longevity. What it is it measures, we wear a mask. This mask basically will sit on your face and it's collecting all of the data of every single breath that you take. So it's analyzing every breath you take in, which is the amount of oxygen you're taking in, and all the air that you're expiring or blowing out, and that's your carbon dioxide. Okay. It gives you ratios of what kind of fuel substrate you're burning. It gives you a ton of information. You are gonna sit at a certain RPM range. So you're gonna spend 3 minutes sitting at 42 to 44 RPM. So it's gonna be watching this value. You're gonna hold that pace and basically using arms and legs, trying to live basically at 43 RPMs. Turn this up a bit. Try to go like 15 seconds holding right here, 15, 20 seconds. This is perfect. Giving it a great effort. Driving legs, driving arms, good. Holding that 70 RPM. So good, you got it. Keep holding, keep holding. And good, done. Perfect, perfect, yeah.
We have a good variety of patients in terms of the population. So we do have folks that are looking for optimal, and we also have folks that are looking for, hey, I want to be more proactive with my health. And we are welcoming and open-armed, and we're a pretty fun group, and we'll meet people where they're at and guide them along, and that journey looks different for everybody.
The success that we see is what motivates us to keep doing this. Like, it is beyond rewarding to see lab numbers change, to see behavior changes around movement, around what you're eating, and seeing people really get over to that line and all of a sudden feeling so different and empowered by knowing the choices that they're supposed to be making is really amazing.